Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us here today. Our guest today is Dr. Estee Williams, Assistant Clinical Professor of Dermatology at Mount Sinai Medical Center. And she's with us today to discuss skin hormones, menopause, and rosacea. Welcome to Health Professional Radio, Dr. Williams.
Good morning. Great to be here.
Thank you for joining us today. Now, you have a special interest in how hormones affect the skin, in particular, a special interest in rosacea. What exactly is it?
That's a great question. Actually, rosacea is a chronic skin condition that affects the face and has two main features. The first is redness, and the second is sensitive skin. I often say that when it comes to rosacea, there are 50 shades of red because there's a spectrum. And redness can be anything from rosy cheeks to pimples that are often mistaken as acne.
Now, when they're mistaken as acne, how severe is that misdiagnosis when it comes to treatment? Is it something that you say, oh, well, this isn't working, and all of a sudden you hit upon the right diagnosis, or do people go years sometimes thinking it's one thing when it's actually another?
Well, as a doctor, the most important thing is to first have a proper diagnosis before making recommendations for treatments. Specifically in the case of rosacea being misdiagnosed as acne, fortunately, these aren't life-threatening conditions, and generally the treatments for both are safe. However, the treatments for acne and rosacea are completely different, and acne treatments can actually aggravate rosacea, leading patients to continue to suffer with their condition for months, if not years, spending money and time at the doctor or buying products at Sephora or the beauty counter that don't actually work for them. And it is extremely important to have the proper diagnosis if you have rosacea.
I've heard it said that pretty much everybody is going to experience acne at one point or another in their life. What is it that causes rosacea? Is it the same type of condition as acne as far as what causes it, and it's just more severe, or are they two totally separate entities requiring that different treatment as you spoke of?
Well, the reason that acne and rosacea can be confused for one another is that a subtype of rosacea called papulopustular rosacea exhibits pimples. So patients have red bumps on the skin. Frequently, they're a little bit painful and irritating, and those bumps look exactly like pimples, and that's the reason that they're confused. But the conditions are completely different. What causes rosacea is essentially that the immune system in your skin, which we call the local immune system, is revved up. It's very, very hyper-reactive. And what that means is that the pathways that are normally turned on by, let's say, a bacterial infection or any other kind of attack on the body that's seen as, a foreign attack, are being turned on by everyday triggers. For example, sunlight and stress and exercise and even certain foods. Those are turning on the same pathways that your body would, turn on if there was a bacterial attack.
Do some of these same symptoms present when, say, one of the poison ivies or sumac or something like that comes in contact? Is that considered an attack and then the rosacea kicks in? Or is that something that happens totally on a within the body?
Great question. So this sort of hyperreactive immune system, it's not technically an allergic reaction in the same way that you get an allergic reaction to poison ivy. It actually is a completely different pathway. On a molecular level, there are different molecules and things that we call cytokines involved, and actually different immune cells, different white blood cells. So the picture is different. And again, like a reaction to poison ivy, we consider more in the, more in the allergic reaction category, whereas rosacea is not an allergy.
You mentioned food being one of the possible triggers for rosacea. Are these food triggers, are they a rarity, or do they just occur differently in different patients?
Great question. So these food triggers can vary from patient to patient. And I wouldn't say that there are specific foods that can trigger rosacea in all rosacea patients. But there is a list, which I have on my Facebook page, that was put out by the National Rosacea Society, which is rosacea.org. And it's a list of about 40 different foods and food groups that are common triggers. And these include foods that release histamine. Histamine is what causes redness. And we know that those are things like fermented foods, wine, certain cheeses. And in other people, it's spicy foods, things that, some people say, oh, I'm allergic to that spice. They're not actually allergic. They have a sensitivity. And there really is a very long list, and things even like nuts and avocado that we consider to be very healthy foods. In some people, it just doesn't react well.
Although I did hear you say that rosacea is not life-threatening by any means, are there different levels of severity, and do those treatments differ?
There's actually, on sort of doctors, there are 4 different classifications of rosacea that have very long, fancy names. But practically, the most basic form would be the rosy cheeks. So on the skin, typically in the middle of the face, there's redness. In close-up, sometimes you could see actual little blood vessels. And patients will say that during the day they flush. They flush and they blush very easily. That's one form. And then you have a more involved form where the skin of the face is covered in things that look like pimples. They're actual bumps. And as the signs of rosacea become more involved and more severe, the treatment becomes also more involved. And so, for example, a person who has like periodic flushing and blushing, I might recommend a prescription medication that helps clamp down blood vessels and reduce redness. Whereas someone who has a lot of bumps on their face, and like I said, these could be painful, may likely benefit from an oral antibiotic to be taken by mouth. So the treatments really do vary based on what the patient looks like.
When a person is is suffering from rosacea, are there flare-ups and then a period of calm, or is there ever a time when an emergency treatment is necessary because something has triggered in such a way that a person needs to seek some right now relief and then maybe seek some relief a couple days later more formally?
Most people with rosacea don't even know they have rosacea. So when they're looking to seek relief and get better, they're not even necessarily aware of what things are helpful and what things are not helpful. It is always best, because this is a chronic condition, to be on a daily regimen. And the best person that can help you with this would be a board-certified dermatologist. And being on a daily regimen helps prevent flare-ups and helps you deal with the flare-ups and cope with them when they do occur. There are rare forms of rosacea where you can have a very, very sudden, flare-up where the skin of the entire face becomes extremely red and warm and painful. And thankfully, that is a rare subtype, but I would say that is something that would need to be urgently seen by a doctor. But for the most part, rosacea is a chronic condition that doesn't tend to be it's problematic and it's distressing, but it's usually not an emergency.
Talking about being problematic and distressing, you treat both adult and pediatric patients. Talk about some of the psychological aspects that you've encountered when it comes to rosacea. Sometimes there are things that prevent people from seeking proper help until maybe it's too late, or until they've just suffered until they can't suffer anymore.
Exactly. The reason why I call rosacea problematic is because the demographic that's affected by rosacea, namely women in their 30s, 40s, and 50s, are typically wrestling with the idea of anti-aging and how to stay young forever. And, the first thing that they're concerned about is the skin on their face. And the problem is that many of these anti-aging products, skincare products, makeup, contain a lot of chemicals and ingredients that are not good for rosacea. So it could become very stressful for these women who want to use anti-aging products, but their skin just can't tolerate it. And so it's not uncommon for me to have a patient come in who, for example, I may have diagnosed with rosacea, and the patient is begging me to start on certain products that I know won't be good for their rosacea. So sometimes it can become a little bit frustrating for them.
Where can our listeners go online and get some more information about rosacea and maybe a bit of background on what's happening there at the College of Dermatology at Mount Sinai Medical Center as far as rosacea is concerned, and maybe look for some possible support?
Sure. So I like to post, helpful tips for my patients and for the public on social media. You can find me on Facebook, Instagram, and Twitter at Dr. Estee Williams. And I also want to point you guys to the National Rosacea Society. Their website is rosacea.org, and they have a lot of really helpful tips and resources.
Well, it's been a pleasure speaking with you this morning.
Thank you.
Thank you. And I'm hoping that you'll come back and speak with us in some future segments.
I would love to.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Estee Williams, Assistant Clinical Professor of Dermatology at Mount Sinai Medical Center. And we've been talking about rosacea, some of the causes, some of the treatments, and some of the psychological impact that often or sometimes leads people to seek treatment a little bit later when they could seek it a lot sooner. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.